my name is Dr. Aldape. I'm a board-certified OBGYN in Riverside, California, and this is my YouTube channel, GynoGal. Today we're going to talk about vaginal discharge. First of all, we need to discuss when you should go see a doctor for vaginal discharge. Every time you notice a change in your normal, if there's a green tint to it, it's a yellow tint, if it has a foul odor, or if there's any pain or itching. The most common things that could be going on are maybe a yeast infection or a bacterial infection that are easily treated, but you also want to get screened for sexually transmitted infections or STIs. Your doctor will be the only one that would screen you for that. There's a few methods to do it. The most common ones are gonorrhea and chlamydia, and for that we can do a urine test or a swab test when you do pelvic exam. And besides gonorrhea and chlamydia, if you have had unprotected sex, you're also at risk for HIV, hepatitis B, hepatitis C, and syphilis, so those are blood tests that you want to ask your doctor to test you for. This is one of the rooms where we can do a pelvic exam, and you can notice those stirrups where we have the patients put their legs up and we do a pelvic exam. We usually use a speculum that looks like this. There's different colors which mean different sizes. And then what we do is we check the type of discharge, if there's an odor. Some doctors just take a swab. It looks like this. It comes in a package and it's a little cotton tube applicator, and we put it into this little tube and send it off to the lab. Some doctors don't send it off to the lab but look at it under the microscope in their own office. There's also a special swab that we use to test for gonorrhea and chlamydia. If the problem is a lesion, like herpes type of lesion, then we would do a swab of that lesion and send it to the lab. The types of infections that could be going on most commonly are probably yeast infections or bacterial infections. For yeast, it's usually an oral pill that you take either once or twice. You can also ask for a cream if you prefer to use a cream, or there's actually some doctors that think that the cream is probably a first-line treatment, and then if that doesn't work, you can use the pill. There's actually some over-the-counter tests that you can check on your own at home. So you can just go to your CVS or Walgreens or your local pharmacy and check out whatever they have over the counter. If you're concerned that your discharge has changed and it's very different, you should definitely see a doctor. For bacterial infections, you're probably going to need some oral or topical antibiotics with an intravaginal applicator. Definitely, if there's a sexually transmitted infection, you're going to need an antibiotic that your OBGYN can prescribe for you. Alright, don't forget to always use a condom for protection against sexually transmitted infections and for pregnancy. Thank you.